Okay.
Hello, this is Amanda Hum, and I am doing my hospital video number 2. This is handsome boy. This is Uno. He is a 6.5-year-old, 11 pounds male neutered cat. We are going to set up for a contrast study for a feline. They usually do not recommend contrast studies for felines because this is difficult. There are multiple ways to do the contrast study. One way is to actually put the contrast in food if they are food-motivated cats. Another way is to use a syringe and try and put it down the throat, or you can use like a red rubber tube and place the syringe in the tube and insert it that way. So I will take measurements for both a lateral and ventral dorsal abdominal view. So for his lateral, he is about 10 centimeters. For his VG, he's about 15 centimeters. So I will refer back to our thoracic chart, and abdominal.
So let me get a close up.
And abdominal here, you will see he's about 54 and 10, for 54 for the KVP and 10 for the MAN. So I will adjust that here. In order to set this up, first we would set up the patient, get him properly placed.
You want the lights off so you can calibrate it better?
The abdominal view, ideally, you would do for an upper GI contrast study, from the xiphoid process to about the pelvis area. You would make sure you have a marker in place. And I've put both of my gloves on as well. And we would have someone, usually a separate person, give the contrast. We would take the first shot at 0 minutes. Then we would flip him on his back to ventral dorsal, which we would adjust the settings for abdominal VD, which again, back to the chart we would look at. He would be about 62 and 10. And then here I adjusted it. We put on his VD. I would again adjust, center him out again from about the xiphoid process to the pelvis. So we pull him down a little bit. Make sure I have both of my gloves on. He's being a very good boy. Almost done. And then I'd have the marker. It's okay. And I would snap. I would do this at 0 minutes, 5 minutes, 10, 15, 30, an hour, and 2 hours until the doctor is satisfied with the radiograph taken for where the contrast study shows. And then from there, the doctor would assess whether or not we take more x-rays or if we were finished from there.